51. Studies on conduct disorder suggest that the disorder has blank component. A. Biological. B. Genetic. C. Psychosocial. D. All of the above. The correct answer is D. All of the above. 52. All of the following are social factors that may predispose a child to conduct disorder, except A. Early maternal rejection. B. Early institutionalization. C. Learning impairment. D. Family neglect. The correct answer is C. Learning impairment. 53. Which of the following are physical factors that increases the risk of conduct disorder? A. Under-arousal of the autonomic nervous system. B. Parental psychiatric illness. C. Substance abuse. D. All of the above. The correct answer is A. Under-arousal of the autonomic nervous system. 54. Which of the following is a sign of conduct disorder? A. Using drugs. B. Neurological impairment. C. Depression. D. Receptive language problem. The correct answer is A. Using drugs. 55. Studies show that children who behave aggressive at age blank continue to do so at ages 11 to 13. A. 2, B. 3, C. 4, D. 5. The correct answer is B. 3. 56. A person who is blank or older doesn't meet the criteria for antisocial personality disorder. A. 16, B. 17, C. 18, D. 19. The correct answer is C. 18. 57. Conduct disorder can be considered to be on which of the following stages? A. Mild. B. Moderate. C. Severe. D. All of the above. The correct answer is D. All of the above. 58. Conduct disorder is considered blank if the conduct problems and effect on others can cause considerable harm. A. Mild. B. Extreme. C. Severe. D. Medium. The correct answer is C. Severe. 59. Blank is a syndrome of persistently sad or irritable mood. A. Unipolar depression. B. Anger. C. Oppositional defiant disorder. D. Attention deficit hyperactivity disorder. The correct answer is A. Unipolar depression. 60. Children with depression are likely to blank. A. Abuse drugs. B. Feel rejected. C. Be irritable. D. All of the above. The correct answer is B. Feel rejected. 61. About half of depressed patients experience blank episode and recover completely. A. 1, B. 2, C. 3, D. 4. The correct answer is D. 4. 62. In children and adolescents, a major depressive episode lasts an average of blank to blank months. A. 6 to 8, B. 7 to 9, C. 8 to 10, D. 9 to 11. The correct answer is B. 7 to 9. 63. Suicide attempts peak during the blank years. A. Childhood. B. Adolescent. C. Mid-adolescent. D. Elderly. The correct answer is C. Mid-adolescent. 64. Among adolescents, suicide is the blank leading cause of death. A. First. B. Second. C. Third. D. Fourth. The correct answer is C. Third. 65. Current research suggests which of the following as one of the causes of depression? A. Genetics. B. Social causes. C. Biochemical causes. D. All of the above. The correct answer is D. All of the above. 66. Among depressed patients, researchers have found imbalances in which of the following neurotransmitters? A. Serotonin. B. Norepinephrine. C. Dopamine. D. All of the above. The correct answer is D. All of the above. 67. Childhood depression differs from adult depression in which of the following way? A. Psychotic features are less common in children and adolescent. B. Anxiety is more common in adults. C. Physical symptoms like pains are more common in adults. D. Psychotic features are more common in children. The correct answer is A. Psychotic features are less common in children and adolescent. 68. All of the following are reasons why depression may go unrecognized by the child's family, doctors, and teachers, except A. Children may have trouble describing their emotions. B. Signs may be mistaken for the normal mood swings. C. Children know how to identify and express their opinions. D. Symptoms of depression may be expressed in varying ways. The correct answer is C. Children know how to identify and express their opinions. 69. Which of the following tools may be useful in screening children and adolescents for major depression? A. Beck Depression Instrument for Children. B. Adults Depression Inventory. C. Beck Depression Inventory for Adolescent. D. Diagnostic Depression Inventory. The correct answer is C. Beck Depression Inventory for Adolescent. 70. Treatment for major depression may entail which of the following? A. Psychotherapy. B. Cognitive behavioral therapy. C. Medication. D. All of the above. The correct answer is D. All of the above. 71. In the treatment of major depression, blank therapy focuses on working through disturbed relationships that may have contributed to the depression. A. Pharmacotherapy. B. Psychotherapy. C. Medication. D. All of the above. The correct answer is B. Psychotherapy. 72. Which of the following treatments for depressed children is controversial? A. Interpersonal therapy. B. Pharmacotherapy. C. Cognitive therapy. D. Behavioral therapy. The correct answer is B. Pharmacotherapy. 73. Medication may be considered as a first-line treatment for children under which of the following circumstances? A. If the child can undergo behavioral therapy. B. If the child can undergo cognitive therapy. C. If the child has recurrent depressive episodes. D. If the child doesn't have psychosis. The correct answer is C. If the child has recurrent depressive episodes. 74. All of the following are nursing interventions that may be appropriate for a child with depression, except A. Find ways to sustain the child's typical routine. B. Help him learn to cope with impulses. C. Monitor him for dangerous behavior. D. Provide appropriate times to eat. The correct answer is B. Help him learn to cope with impulses. 75. Blank is a neurobehavioral disorder characterized by sudden involuntary muscle movements and vocalization. A. Hallucination. B. Tourette syndrome. C. Down syndrome. D. Attention deficit hyperactivity disorder. The correct answer is B. Tourette syndrome. 76. Motor tics tend to affect which parts of the body? A. Head. B. Kidney, C. Lungs, D. Ears. The correct answer is A. Head. 77. Tourette's syndrome usually appear before the age of blank. A. 18, B. 19, C. 20, D. 21. The correct answer is A. 18. 78. Tourette's syndrome usually becomes apparent between ages blank and blank. A. 1 to 14, B. 2 to 15, C. 3 to 16, D. 4 to 17. The correct answer is B. 2 to 15. 79. Roughly one-half of the Tourette syndrome patients experience symptoms by age blank. A. 5, B. 6, C. 7, D. 8. The correct answer is C. 7. 80. Many people with Tourette syndrome have which of the following associated behavioral problems? A. Obsession and compulsion, B. Inattention, C. Hyperactivity, D. All of the above. The correct answer is D. All of the above. 81. Which of the following is typically the first sign of Tourette syndrome? A. Eye blinking, D. Body bending, C. Foot stamping, D. All of the above. The correct answer is A. Eye blinking. 82. Which of the following tends to worsen tics of a Tourette syndrome patient? A. Excitement, B. Obsessive thinking, C. Coprolalia, D. All of the above. The correct answer is A. Excitement. 83. Which of the following is a sign of Tourette syndrome? A. Compulsive behavior, B. Boredom, C. Tiredness, D. Stress. The correct answer is A. Compulsive behavior. 84. Before a patient can be diagnosed with Tourette syndrome, tics must be present for at least A. 6 months, B. 8 months, C. 10 months, D. 12 months. The correct answer is D. 12 months. 85. The purpose of psychotherapy in the treatment of Tourette syndrome is to help the patient and family learn about blank. A. The nature of the disorder, B. How to manage symptoms, C. Stress management strategies, D. All of the above. The correct answer is D. All of the above. 86. Specific drug therapy in the treatment of Tourette syndrome may involve which of the following drugs? A. Prozac, B. Zoloft, C. Haloperidol, D. Paroxetine. The correct answer is C. Haloperidol. 87. Which of the following nursing interventions may be appropriate for a child with Tourette syndrome? A. Promote the child's self-esteem. B. Monitor him for dangerous activities. C. Identify abusive communication. D. All of the above. The correct answer is A. Promote the child's self-esteem. 88. Blank is characterized by inappropriate responses to the environment and pronounced impairments in language. A. Tourette syndrome, B. Autistic disorder, C. Mental retardation, D. Conduct disorder. The correct answer is B. Autistic disorder. 89. All of the following about autistic disorder is true except A. An autistic child lacks interest in social interactions. B. Autistic disorder occurs in 7 to 8 of every 10,000 children. C. It is more common in boys than girls. D. It begins in childhood and lasts throughout life. The correct answer is B. Autistic disorder occurs in 7 to 8 of every 10,000 children. 90. Which of the following are signs of autism? A. Hand flapping. B. Insistence on sameness. C. No fear of danger. D. All of the above. The correct answer is D. All of the above. 91. Usually, autistic disorder is diagnosed by age blank. A. 2, B. 3, C. 4, D. 5. The correct answer is B. 3. 92. All of the following are screening tools for autism except A. Checklist for autism in toddlers. B. Autism screening questionnaire. C. Adult autism scale. D. Screening test for autism in 2-year-olds. The correct answer is C. Adult autism scale. 93. Autism is diagnosed based on clear evidence of which of the following? A. Poor or limited social relationships. B. Underdeveloped communication skills. C. Repetitive behaviors. D. All of the above. The correct answer is D. All of the above. 94. Blank refers to below average general intellectual functioning with associated deficit in communication, social skills, self-care, and adaptive behavior. A. Mental retardation. B. Autism. C. Conduct disorder. D. Tourette syndrome. The correct answer is A. Mental retardation. 95. A child with mental retardation has IQ below blank. A. 100. B. 90. C. 80. D. 70. The correct answer is D. 70. 96. Moderate retardation is found between blank. A. IQ 20 to 34. B. IQ 35 to 49. C. IQ 50 to 70. D. IQ 81 to 100. The correct answer is B. IQ 35 to 49. 97. Which of the following are major signs of mental retardation? A. Neurologic impairments. B. Destroys property. C. Drug and alcohol use. D. Inquisitive behavior. The correct answer is A. Neurologic impairments. 98. Which of the following tests are used to measure social maturity and adaptive skills? A. Standardized IQ test. B. Development screening test. C. Bailey scale of infant development. D. Vine behavioral scales. The correct answer is D. Vine behavioral scales. 99. Which of the following is part of the key components of treating mental retardation? A. Behavior management. B. Environmental supervision. C. Family therapy to help parents develop coping skills. D. All of the above. The correct answer is D. All of the above. 100. When treating a patient with mental retardation, which of the following is very important? A. Teach the child adaptive skills like eating, dressing, and toileting. B. Assign different tasks to the child. C. Improving her self-esteem. D. Provide physical outlets for aggression release. The correct answer is A. Teach the child adaptive skills like eating, dressing, and toileting.